All right, I think we are going to go ahead and get started. So I just want to thank everyone for being here with us today. We're excited to be holding our Choices Community of Practice October Coffee Chat, and we're really glad to have you all here with us. So thanks for joining. Again, if you're just coming on, please introduce yourself in the chat, share your name, title, and organization. We'd love to have a sense of who's joining us today. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health, and I'm happy to be facilitating our coffee chat today. The topic for today's chat is strengthening partnerships to improve child health. Maybe go to the next slide. I just want to take a moment, as always, to acknowledge our funders who make this work possible, and make a note that our Choices work and our events are for research and educational purposes only. And today's event is intended to provide tools and resources and information to inform and educate, and is not an attempt to influence any specific legislation. Next slide. So for those who might be new to the Choices Community of Practice, I just want to say a few introductory words. So the Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And it's our goal at the Choices Project to support those efforts by providing tools, resources, and training opportunities such as this. And our coffee chats are kind of unique, informal opportunities to gather ideas, innovate together, and get to know each other better. Next slide. So today, we're going to be discussing the role and value of partnerships in improving the health of the community. Collaborating with partners across sectors is often a key and essential part of the community health improvement process. And this is particularly relevant for health agencies that are focused on reducing the burden of obesity and chronic diseases in their communities. And as we know, we really need to implement a range of strategies across sectors to ensure that children have opportunities to eat healthy and be physically active in order to prevent excess weight gain and reduce their risk for chronic disease. And there are so many ways that health agencies can go about engaging and convening partners in this kind of work. And we're really looking forward to hearing an example of that today. So I'm really excited to introduce our speaker. We have here with us today, Hannah Hardy from the Allegheny County Health Department, who will be sharing about her experiences with engaging partners to improve child health in Allegheny County, Pennsylvania, to address the key priorities identified in their community health improvement plan. So Hannah is the manager for the Chronic Disease and Injury Prevention Program at the Allegheny County Health Department. In her current role, Hannah is responsible for overseeing the implementation of the countywide health and wellness campaign, Live Well Allegheny, and all the programs and activities of the Chronic Disease and Injury Prevention Program, including the Traffic Safety Education Project and Safe and Healthy Communities Program. She's a principal investigator for 2 cooperative agreements with the Centers for Disease Control and Prevention. Hannah has a 20-year career working in a mixture of both nonprofit and local government positions in the areas of community development, public health, and the environment. So thank you so much, Hannah, for being here with us this afternoon. We're looking forward to hearing from you in a few moments. So before we transition to our partner sharing session to hear more from Hannah, I want to just mention our goals for today. So by the end of the chat today, we hope that you'll have a better understanding of the value of engaging community partners to address key priorities identified in the community health improvement process. We hope that you'll also learn about the ways to engage partners in identifying and prioritizing strategic opportunities for action to improve healthy eating and active living. And we also plan to give you an opportunity to network a little bit with peers and learn from others about kind of opportunities or challenges or maybe some resources to engage partners to improve child health in your communities. So lastly, I just want to encourage everyone to please ask questions, make comments, engage with us through the chat or verbally throughout the coffee chat today. We really welcome engagement from everyone on. So with that, I think we will go ahead and get started, and we'll kind of turn over to our partner sharing session at this time. So to start us off, Hannah, could you please share about how the Allegheny County Health Department approaches the community strategic planning process, and in particular, really interested in hearing your process for engaging community partners to identify priorities in your community health assessment and then your community health improvement plan.
Great, thanks, Molly. And just a sound check to make sure you can still hear me okay. So I'm assuming it's okay unless you
great.
Great, okay, wonderful. Thank you. First of all, thank you for including me in this. I've really enjoyed and learned, just cannot underestimate how much I have learned as part of our participation in the Choices program, which we're going to talk a little bit about, but just, the ongoing networking. So I appreciate being asked by the team, and certainly I hope to really learn from you all as we get through this discussion. So I want to kind of tell a little bit of like the path that we went on that kind of led up to our work very specifically with Choices, because I actually found it to be pretty impactful for us. So many of you who are health department representatives who are on the call are in the cadence of doing your community health assessments and community health improvement plans. Our community health improvement plan, we're actually right now, hopefully this fall, I guess it's almost winter now, we will be releasing our next plan. But our first, our most recent community health improvement plan was released in 2015, called the Plan for a Healthier Allegheny. And, with the pandemic, we're a little bit, past that 5-year cadence. But the way that we really worked on that was through an advisory coalition, a multi-sector advisory coalition that had over 70 members, everything from, people that I work with in the health and wellness field to transportation organizations, school representatives. It was fairly multi-sector. So chronic disease risk behaviors is one of our focus areas of our community health improvement plan. And we maintained very active working groups after the release of our community health improvement plan. So we were convening with myself, and then we also had a non-health department co-chair always, working groups that met on a quarterly basis. So our chronic disease working group. So we certainly did a lot of convening in those groups, did a lot of work in those groups, but we were really kind of thinking about what can we do? Okay, we all talk about moving the needle on health, right? What can we do collectively? So our previous deputy director, he was trained in strategic doing, which is, a facilitation tool. So we walked this working group through a strategic doing process. And really what that was about was to identify the opportunities for collective action. And really at the end, when we went through this whole process, reducing childhood obesity rose to the surface as a top priority for our chronic disease risk behaviors working group. Everybody said, if we're going to impact rates of chronic disease in Allegheny County, everybody around the table, whether it's a hunger advocacy organization, whether it is, the YMCA, whether it is Boys and Girls Clubs, everybody said, we all can and should be having an impact on childhood obesity. Not only that, but there's probably something that each of our organizations can do as it relates to childhood obesity. So then we received, I put together a funding opportunity. We have a local public health information fund, which I can talk a little bit more about, but I won't right now in terms of time, but I could tell you about it. We put in an application to get, really it was about people power to focus on developing a collective impact initiative focused on reducing childhood obesity. So that led to our Healthy Kids Allegheny Task Force. The connection was quite strong still with the Plan for a Healthier Allegheny and our working group, but it gave us the opportunity to bring on some new partners. And then and I can't remember, Jenny can remind us which year we were with Choices, but then Choices was just like perfectly matched with when we were working on this Healthy Kids Allegheny Task Force and this collective impact larger picture work that we're doing, like the choices, it just was like perfectly timed. So that's just a little bit about kind of our path, Molly, that I think is important that we used to advance our efforts.
Thanks so much for sharing all that, Hannah. I think it's helpful to hear how your CHIP process was kind of the basis for bringing together partnerships, and how the working group you formed was focused on identifying those opportunities for collective action. And I loved how it helped lead you to identifying healthy child weight as a priority. I think that's great. And I think kind of building off of that, I'd love to hear more about the partners and organizations you engaged to advance, some of those priorities. And, if you could share a little more on how you engaged and built those partnerships, and if there were any kind of key strategies or tips that you learned from your successes that you could share with the group.
Hey, how are you? Mm-hmm. Well, and you just said this, so I'm not going to continue to say it, but just to highlight, that the leadership from, the fact that we could tie this interest back to our community health improvement plan and had that, gave us that strong foundation, right? So then to talk a little bit, and, some of our partners are listed here. Some of these partners were not members of our community health improvement plan. So I think specifically about the Allegheny County Partners for Out of School Time. So that is a convening. They're based at the United Way, but that's a convening of all of the out of school time partners in Allegheny County. So then, as we were kind of zeroing in on where do our kids go, who has contact with kids that can have an impact in kids' lives, then we started to seek these other, it really sharpened our focus on, if we were sharpening our focus on reducing childhood obesity and healthy kids, then, it really gave us the opportunity to think through who should be at the table for the Healthy Kids Allegheny Task Force. So that's an example of a new partner. Let me just talk about, I think one way to answer this question is just to talk about some of the roles of some of the different groups that we engaged as part of this. So if the Healthy Kids Allegheny Task Force was looking at the bigger picture in this collective impact strategy, we also, one key partner is our Children's Hospital of UPMC of Pittsburgh. They are the local intermediary for the Alliance for a Healthier Generation and have brought that model to Allegheny County. So in that capacity, they're working with school districts. We have 43 school districts in Allegheny County. They're not in all of them, but they're in, they're working and have agreements with, a couple of the school districts, and they're working in the schools with the nurses, and with the, physical education teachers on the application of the Alliance for a Healthier Generation model and the Healthy Schools program and Healthy Out of School Time. I mentioned APOST and their, convening of after school programs and people who fund all of those programs. Through the Pittsburgh, this opportunity really gave us the opportunity to be working more specifically with, for example, the Pittsburgh Public Schools and the Allegheny Intermediate Unit. I don't know, do other places have Allegheny Intermediate Units? It's an entity that serves all of the school districts in Allegheny County, and they do joint trainings, things like that. And we had several of our meetings there. They became a big partner because once we were meeting with the Allegheny Intermediate Unit, that was a way to communicate with all of the school districts. Another kind of key and very interesting connection that we made through this initiative was with people who are training wellness educators. So we had some very active partners from Slippery Rock University and their wellness education program, thinking through who are the people who are training future wellness educators. I think this will be, we specifically chose interventions, and I think we'll talk about that next, or I can't make sure I talk about that. The interventions that we chose for choices were kind of chosen for specific reasons based on some of the partners that we really wanted to build. We wanted to build stronger partnerships with our schools and out of school time settings and that's part of the reason why we chose the two interventions that we chose from the choices model.
Great. Thank you, Hannah. Thanks for sharing so much insight into all of that and all the different partners that you engaged across school, after school. And then I think you highlighted earlier, and then again now, just how the Choices partnership opportunity kind of helped, mobilize your efforts. So I think maybe turn to that a little bit. I'd love to hear if you can elaborate a bit more on how applying cost effectiveness analysis kind of helped support your efforts and in cross-sector collaborations, and what you learned through engaging partners in the Choices work.
Mm-hmm. So this might seem really basic, but I mean, the cost, by applying the cost effectiveness analysis framework, it's such a tangible tool. It gave us something that is so tangible and a very focused project that enabled us to further develop our partnerships. So for example, one of the interventions that we chose had to do with physical activity during the school day. And that is such a very specific way that we can talk to the Allegheny Intermediate Unit, the other school partners, about what they do best. It's not us coming to them and saying, this is what we're doing here in public health. So I think that, was a very unique opportunity that this tool presented to us. So, in terms of successes, having it also is a real educational opportunity for all of us. It enabled us to bring the resources of the Choices project, through the workshops and the facilitated just process. Really increased everybody's level of understanding as it relates to how to implement initiatives that are hopefully going to impact healthier kids. I think that you'll also see some of that come through in the goals of our project. So some of the goals that we set out were informing and advancing the work of the Healthy Kids Allegheny Task Force, providing evidence to drive action on high impact childhood obesity policies, and providing that justification for public investment in prevention. I have some lessons learned. These are like very specific lessons learned. And I think it's actually kind of interesting for you all, it'd be interesting, this could be part of our discussion. But some of the things that came out as we were reflecting on this is that, our PE teachers, physical education teachers, they really consider themselves, public health advocates and really care about, they were some of our biggest champions. No teacher wants to, really admit that they're not keeping their kids physically active during PE class, right? We learned some things as part of this process. Enrollment data is difficult to obtain, particularly with our out of school time settings. One thing that one of our strategies, which was another lesson learned that we modeled, had to do with sugary sweetened beverages and things like that from outside in the out of school time setting. One thing that was particularly enlightening that came out in the cost effectiveness strategy had to do with thinking about parent costs and when parents are buying snacks and things like that. And that was kind of an interesting discussion that we had about the potential benefits for implementing a policy if it meant that, of not bringing outside snacks in, if it, perhaps one thing that we could do would be to save families money. So that was kind of, just some interesting anecdotes from the work that we did.
Thank you so much for sharing all that, Hannah. I think it's nice to hear you saying that this process kind of helped you with aligning the goals of the task force and providing that justification for, like you said, for the investment in prevention is great. And I love at the last bit there, how you highlighted that using cost-effective analysis and that sort of framework had sort of some unexpected things that you saw, seeing the costs that parents would save, by not bringing in outside snacks to after school programs. I think that's a great, specific point to highlight. So appreciate that.